Hello everyone, I'm Dr. Katona. I'm the medical director for the Art of Hair Restoration and Katona Hair Restoration. We have a patient who had a procedure not more than 12 hours ago. So I think we're so fascinated and everybody's so focused on kind of the result of that. Like I said, we're only about 12 hours out. 3,036 grafts, recreated a hairline for him. Nice, irregular, very natural, working back, extending into the crown area. So we're so proud how clean and nicely this all looks from just yesterday, 12 hours ago. But we're so proud of ourselves in terms of how we handle the donor area, which is completely neglected in our field. We're using 0.7, 0.8 millimeters punches for the back. I want you to take a look. And this is with 3,036 grafts, and each one of these really corresponds to a graft that we harvest. So if you can see, we're trying to get a panoramic view. Again, this is just 12 hours later. Look how clean that is, right? We didn't wash it. We just had one of our normal bandages on. So we haven't even touched it. We haven't even cleansed it. This is all just from the patient from last night. And we'll just rotate just a little bit more. We see the center. And similarly here on the left side, I don't know if that can be captured. Should we rotate a little bit more? We can rotate just a little bit more to see that left side of that donor. Spinning you around like a hamster here, sorry. Thank you so much. So that donor looks great. Now the important take-home point for the donor is that that area is so clean. Our punches are so small, so minimally invasive, right? We probably tapped less than 10% of what the donor will allow us to take. So this represents about 3,036 grafts. We could probably do another 5,000-6,000 grafts if a patient wanted to, meaning we're leaving plenty of donor grafts in the future because he's a younger patient. So if you ever wanted to work further back towards the crown with future hair loss, we can do that. Or if we ever wanted to do some density work, we can do that. So what's so critical in hair transplant, which is completely ignored, neglected, and just swept under the rug, is the donor area. This is pure gold, okay? Folks, you only have so much to work with. How you handle this dictates the ultimate result, not just for today, but for the future. So particularly for those younger guys out there who are concerned and are thinking about the donor, what's in store for us? You gotta harvest using smaller instrumentation, counterintuitive, that allows us to get a bigger and better graft, okay? But that's protecting the donor for the future and anticipating future hair loss or future hair loss needs. So this is such a critical point for you younger guys out there. Not that we don't care about you older guys, you're important too, but especially for the younger guy who's suffering from hair loss earlier in their years. This is how you really need to do it. This is hair transplant surgery at the very highest level. So very proud of this. I just wanted to show this to everybody. Hope you're able to appreciate it. There's a lot of fine and sophisticated points in there. We can help explain those and maybe further explain what all of that really means to you folks out there. So stop by our clinic. If you can't do so, we're happy to do online consultations and really flesh out what all this means and how we handle all of this. So hope to see all of you soon.